Hello everyone, welcome back. This is Lena Palaniappan again, and this time I'm going to take you through forensic psychiatry. So not critical appraisal, this time it's forensic psychiatry. So forensic questions, you usually have 5 to 7 questions in your exam, in your paper B. We haven't seen more than that usually in paper B exams, but nevertheless those 5 to 7 questions may be the key questions that take you through the cutoff, take you past the cutoff for passing this exam. So make sure you don't neglect any area of clinical topics. And as usual with paper B exams, as we have observed in the past, there is a question bank from which most questions are drawn. And in forensic psychiatry, the key themes are usually around prevalence of mental illness in different forensic settings. It's also around recidivism rates across different offenses. Usually you don't get any questions on Mental Health Act. In fact, there has been no questions on Mental Health Act as it applies only to England and Wales. We do see questions about defenses, psychiatric defenses. Remember, these defenses are not specific to any judicial system. Things like plea for insanity. These are common principles that usually they test in the exam. Fitness to stand trial, plea of insanity, things like that. So let's see the questions now. Question 1. The prevalence of psychotic disorders in prisons compared to the general population is 5 times, 10 times, 20 times, 40 times, or 50 times. So what is the factor by which the prevalence of psychotic disorder increases in prisons? The answer is 10 times, and the most decisive result which gives you the answer for this particular question comes from a study reported by Terry Brugger and others from Leicester in 2005, published in American Journal of Psychiatry. So you could see the results highlighted here. The prevalence of psychosis in the 1 year prevalence of psychosis was 4.5 per thousand in the household survey. So this is in the general population. It's around 4.5 per thousand. In the prison survey, the weighted prevalence was over 10 times higher. So it's around 50 per thousand. Okay, so it's 10 times higher, and the actual rate is 50 per thousand. So please remember this. These two statistics are tested very often. 10 times higher, and it's 50 per thousand in prison population. The answer is B. Second question, what percentage of people charged with sexual offenses have no previous history of sexual offenses? So the important thing here is most of us would think that people who are charged for sexual offense would have a very high past history of being charged with sexual offenses. But reoffending, if you look at reoffending rates in sexual offenders, most sexual offenders do not reoffend sexually over time, contrary to popular beliefs. In general, 75 to 80% of sexual offenders have no previous conviction for a sexual offense, indicating that most convictions are of first-time offenders. And this has been shown repeatedly over the years. Many studies in different countries, Hansen and Buziers, Langen, Schmidt and DeRose in 2003, Harris and Hansen did a very extensive review in 2004. The results haven't changed for decades now, and this is the truth about reoffense rates in sexual offenders. 75 to 80% of sexual offenders do not have a previous conviction for a sexual offense. So the answer for this is 80%. Percentage of people charged with sexual offense with no previous history is 80%. What is the best predictor of future sexual offenses? Previous non-sexual offenses, lack of victim empathy, mental illness, history of illicit drug use, previous sexual offenses. Okay, so past behavior predicts future behavior, and this is a specific statement. A specific past behavior predicts a specific future behavior, so that goes without saying. Then the answer is previous sexual offenses. That's going to be the best predictor of future sexual offenses. See, the conviction rate statistics is different from just predicting behavior, so remember that. Just because conviction rate statistics defies our common conventional belief, it doesn't mean the behavior itself defies those beliefs. Behavior wise, past behavior will predict future behavior. Okay. E. Low rates of recidivism in a sexual offense are indicated by which of the following features: extrafamilial child molestation, incestual sex offense against a child, multiple paraphilias in the offender, homosexual molestation, offense against an adult stranger. So which one of these 5 features predict a lower rate of repeating the same offense? Turns out that incestual sexual offense against a child is not usually repeated. It's not a repeated offense. This is usually a crime with some degree of passion or some degree of opportunistic crime. So this is not a crime that usually is associated with a personality or a repeated offending pattern. So incestual sex offense against a child. B. An 18-year-old man shows repeated episodes of violent behavior causing bodily injury and property damage. Police have been called on numerous occasions. There is a restraining order against him. He does not show any other problems with his behavior or conduct and feels remorseful for his behavior. So this is not antisocial personality. Okay, he feels remorseful for his behavior. Most appropriate treatment is, how do you treat this? Lithium, SSRIs, logotherapy, family therapy, CBT. How do you treat this? Okay, so the answer is lithium. What would be the diagnosis? This is likely to be intermittent explosive disorder. So explosive violent behavior with remorse and repent after the behavior. So for intermittent explosive disorder, you could use lithium. You can also use anti-epileptics such as valproate or carbamazepine. But lithium is a good choice in this question. A. Which of the following is correct with respect to automatism? It's a common plea. Epileptic automatism is classified as insane automatism. Automatism is commonly seen in REM sleep behavioral disorder. Subjects cannot have complete acquittal when making a plea of automatism. Sane automatism is due to internal causes. Okay, so automatism, let's look at the legal classification of automatism. Remember, in forensic psychiatry, when we talk about automatism, we're not talking about the epileptic automatism that you see as a behavior preceding an epileptic fit or behavior during a temporal lobe epilepsy. That's not what we're talking about. Here we're talking about legal definition of automatism. Legally, automatism is classified into 2 groups: sane automatic behavior and insane automatic behavior. Sane automatism is where the act is just one-off, which if upheld, complete acquittal is possible in courts. So things like getting drunk and beating up your neighbor is sane automatism, because the act is likely to be one-off. If you don't get drunk, it's unlikely you will beat up your neighbor again. So this is sane automatism. Behavior not under your control because you were drunk, but you could stop the behavior by simply controlling something that's under your control, which is drinking. Insane automatism are likely to recur and thus incline towards psychiatric and medical disposal. So if you are pronounced to have insane automatism, it's unlikely you will have complete acquittal. You would be disposed of to a psychiatric hospital or another medical method of disposal if you're going to be given any sentence, any judgment other than a prison sentence. Is going to be either psychiatric or medical disposal. So what are insane automatisms? These are automatic behaviors that have a high chance of recurrence. Let's say if you're diabetic and every time you have hypoglycemia, you're going to become irritable, angry, and throw objects at your spouse. If you do that, those kind of crimes are likely to be recurrent because hypoglycemia can recur. You have diabetes, so hypoglycemia can recur. So that is classified as insane automatism. Can you see how the sane versus insane, the use of the word sane and insane is not actually in accordance with what we usually conventionally use these terms for. This is in accordance with recurrence of automatic behavior, and this is a legal definition. This has nothing to do with underlying medical disorders. So which of the following is correct with respect to automatism? It's a common plea is not correct. It's very rarely used in the court settings. Epileptic automatism is classified as insane automatism is correct because it can recur. Just like hypoglycemia, epilepsy can recur. So B, is correct. Epileptic automatism is called insane automatism. What percentage of people in police custody has mental illness at the time of arrest? So the answer for this is, at the time of arrest, you only have 5% of people having signs of mental illness. That's according to the data from the UK. The most frequently used tool for the major personality disorder seen in forensic psychiatry is. The question is, what is the major personality disorder that you see in forensic psychiatry? It is usually, yes, antisocial personality disorder, but in particular we are interested in a subconstruct of antisocial personality. What is that? Psychopathy. So which tool can be used to measure the degree of psychopathy among individuals? We can use PCLR, Psychopathy Checklist Revised. This is also called Hare's, H-A-R-E, Hare's Psychopathy Checklist. You're asked to write a court report for a man convicted of a sexual assault. Which of the following is most likely to increase his risk of further offending? Personality disorder, substance misuse, concurrent arson charge, 2 previous charges of sexual violence, poor social support. So if there is a history of previous charges, that's going to increase the risk of reoffense. Okay. Well, remember, the number of reoffenders is low within group of sexual offenders, but reoffenders repeatedly reoffend. So D is the right answer. So 10th MCQ, what percentages of people who commit homicides have a mental illness? Homicide and mental illness, 1 in 6. So it's 15%. Okay, nearly 1 in 6 homicides have some indication of mental illness in the perpetrator. So 15% is the right answer. Okay, so what percentage of people convicted of indecent exposure have no previous record of sexual offenses? Well, indecent exposure is a slightly atypical crime. 20% of those who are charged with an indecent exposure have no prior record of any sexual offenses. And the offender, after a conviction, usually stops reoffending. Indecent exposure, when you convict someone, they usually stop reoffending. Only 20 to 30% of first-time offenders will reoffend. But 60% of people with a history of previous sexual offenses, when they are convicted for indecent exposure, they will continue to reoffend. Okay, so in other words, people who are career indecent exposure perpetrators, people who have prior history of sexual offenses, they are going to go on to commit more reoffenses. But the first timers, only small proportion of them will reoffend. And at the time of conviction, only 20% of people have no prior record of sexual offenses. Okay, so in other words, a small group will carry on committing most of the indecent exposure offenses. 20% is the answer for this question. Which of the following is an accurate reflection of genetic factors associated with a criminal behavior? Callous traits are the most heritable in conduct disorder and antisocial individuals. Antisocial traits show 90% heritability. Criminal behavior is purely environmental. Increased crime rates are associated with higher MAOA levels. Monozygotic twins are less concordant than dizygotes for antisocial behavior. So what is correct here? Callous traits. So when you see a conduct disorder child with callous traits, lack of empathy, those traits are most heritable. Okay. Which of the following statements is true regarding sex offending behaviors? Mood disorders are rarely seen in sex offender populations. That's not correct. Depression is quite common among sex offenders. Psychotic disorders are not commonly seen in sex offender populations. Yes, that is true. You rarely have psychotic disorders as the underlying reasons for sexual offense. You also don't see much prevalence of psychotic disorders among sexual offenders. Substance abuse disorders are not commonly seen in sex offender populations is wrong. Many of them use substances. Anxiety disorders are rarely seen is also wrong. More serious offending is not associated with more severe psychopathology is wrong. The more unwell somebody is, the more serious offending may be seen. So the correct answer is psychotic disorders are not commonly seen in sex offender populations. Insane automatisms due to sleepwalking may be offered as a defense for homicide. Which of the following features makes a diagnosis of sleepwalking more likely? Offense occurs within 2 hours of going to sleep. Dream-like recollection of the offense. Narrative-like recollection of the offense. The patient awoke with intense feelings of anxiety and fear. Attempt made to conceal the offense. So which of them make sleepwalking likely? Now, sleepwalking is a non-REM behavioral disorder. Remember, during REM sleep, what will happen? Your muscle tone will be lost. So this is a non-REM behavioral disorder. So which part of sleep during the course of the night, which portion of the sleep is predominantly non-REM? The early part, the first 2 hours. So if the offense for which you claim sleepwalking as a defense, if that offense is occurring in the first 2 hours of going to sleep, it's likely to be sleepwalking related offense. Okay, it's more likely. So A is the right answer. A patient admitted to a psychiatric intensive care unit has delusions of passivity. He believes that his actions and words are controlled by the devil's soul. He claims that the devil's soul takes over his body and punches his doctor who is trying to poison him with antipsychotic medications. This group of symptoms has been referred to as thought alienation syndrome, threat control override syndrome, malingering, passive activity syndrome, passivity loss syndrome. So this patient shows a group of symptoms, paranoia and also delusions of control. So the combination of paranoia and delusions of control in forensic setting goes by the term threat control override syndrome or TCO syndrome. This was originally described to be associated with increased risk of violence, even though recent studies have challenged this notion. So this is TCO, threat control override. That's the right answer for 15. Next question, the risk of stalking by a patient or patient's relative over the course of a healthcare professional's career is, so if you're a health professional, what's the chance of you getting stalked? Now the answer for this question comes from a survey conducted by Royal College of Psychiatrists. The answer is 20%. So 1 in 5 of you will get stalked by a patient. That makes me wonder why all of us try really hard to become members of Royal College of Psychiatry. This just increases our chances of getting stalked. Anyway, keep that number 1 in 5 in mind. Risk of stalking is 1 in 5 over the career of a healthcare professional. When asked how many legs a cat has, a 41-year-old male prisoner answers 5 legs. This is known as, this is Ganser's syndrome. Okay, so this is Ganser's syndrome. Well, you know what Ganser syndrome is. It's associated with conversion-like symptoms. It's classified as a dissociative disorder in ICD-10, usually seen in prisoners. So factitious disorder, well, it has factitious components, hysterical and conversion-like components. So if you ask a question, how many legs a horse has or a dog has, the patient understands the question. So they don't say something completely tangential, but they say something which is past the point, and this is called Warby-Redden. Warby-Redden, or past the point answering, is seen in Ganser syndrome. So the answer for 17 is C, Ganser syndrome. Which of the following is most common in people with autistic spectrum disorder? Pickpocketing, armed robbery, fire setting, burglary, car theft. Properties, offense against properties is common among the learning disabled and also in autistic spectrum. And for some reason, arson, fire setting, is more disproportionately more often seen in autistic spectrum. The percentage of violence in the population that can be ascribed to psychosis is, so this is PAR, population attributable risk of psychosis. In the entire society, how much of violence you see in the society could be attributed to presence of psychosis. In other words, if you completely eliminate psychosis from this world, how much violence can you actually reduce? Only 5%. So only 5% of violence is attributable to psychosis. Okay. Drugs that may be helpful in the treatment of sex offenders include all of the following except selective serotonin reuptake inhibitors, SSRIs. Yes, you could treat depression, you could treat impulsivity with that. Anti-androgens, sometimes used in chemical castration. Estrogens also used in chemical castration in paraphiliacs. Long-acting gonadotropin-releasing hormone agonist analogs. So gonadotropin analogs can also be used to reduce sex drive. Sildenafil citrate. Okay, that's not something you would like to use in repeated sexual offenders. That's Viagra. So that's not the right answer. E is, that's not the right option. That's not the right medication, but that's the correct option, E. 21. The most common offense in people with learning disability is sexual offense, fire setting, fight, Stealing, offenses against property. Yes, that's correct. Offenses against property is the most common offense in people with LD, learning disability. With respect to arson, which of the following is correct? Alcohol misuse is very common. Yes, that's true. Males offend more than females. That's true as well. Associated with low IQ. Yes. Women receive disproportionately more psychiatric disposals. That's correct. A woman who sets fire is more likely to go to a psychiatric institution compared to a man who sets fire. All of the above is the correct answer. Factors that increase the risk of stalking behavior include all of the following except substance misuse, history of offending behavior, making threats of violence, female gender, presence of narcissistic personality traits. So it's quite likely that, this question is not very clear in terms of who are we talking about? Is it the victim or the perpetrator? Let's just assume that this is about the perpetrator in forensic psychiatry setting. So perpetrator with substance abuse, yes, high risk of stalking. History of previous offending behavior, yes, that will increase risk of stalking. Making threats will also increase the risk of stalking. Female gender, so victims are likely to be females, but perpetrators are likely to be males when it comes to stalking problem. So D is the right answer here, assuming the characteristic traits in question are for the perpetrator. Okay, so keep that in mind. The percentage of children with conduct disorder who go on to have antisocial personality disorder is, this number is 50%. Remember, conduct disorder, half of children with conduct disorder will go on to become ASPD, antisocial personality disorder people. Okay. The commonly seen psychiatric side effects of cyproteron acetate. Cyproteron acetate is an anti-androgen. So what's the commonly seen psychiatric side effect of this drug? This drug is very rarely used in chemical castration. Not so much in British prisons, but in places in Europe, it's still being used for chemical castration and paraphilia. So any steroid, this is a steroid. Any steroid that you use, a side effect that you get is depression. Depression is a common side effect of using steroids. The most common type of delusion seen among stalkers is jealousy, love, persecution, reference, and control. Remember, stalkers can have any type of delusion, but the most common delusion among stalkers is erotomanic, delusions of love. That's followed by delusions of paranoia or jealousy. Okay, so erotomania is more common than paranoia or jealousy, especially among intimacy seeking stalkers who wants to become intimate with the victims. They usually have erotomanic delusions. So the answer is love, delusion of love is the answer for 26. 27. Which of the following is true for female offenders? Less likely to have a psychiatric disposal? No, more likely. Higher rate of reoffending than men? No, lower rate of reoffending. Less likely to self-harm than men? No, more likely to self-harm. Violent offenses are more common than crimes of passion? No. Most offenses perpetrated by female offenders are crimes of passion, which means they are committed against people that they know, family members. More likely to offend against family? Yes, this is what I just mentioned. So E is the correct answer. Female offenders are more likely to offend against family compared to male offenders. E. Which one of the following is a structured risk assessment tool? Static, VRAG, PCLR, PRS, SARA. Now, SARA stands for Spousal Abuse Risk Assessment Scale. So this is for SARA, Spousal Assault Risk Assessment Scale, SARA, and this is a structured tool. The other tools that you see here are VRAG, PCL. These are actuarial tools or clinical tools. SARA is a structured tool. Which of the following is true about sane automatism? Includes epilepsy? No. Very common defense? No. Complete acquittal is possible? Yes. Defendant has had some control? No. Intent to harm need to be excluded? No. So complete acquittal is possible for sane automatism. Sane because there is less chance of this recurring. So it's not epilepsy. It's not a common defense in psychiatric patients. So because it has low chance of recurrence, the judge or the jury can completely provide acquittal to the defendant. The defendant has not had any control. So even though the behavior, even though the actual inciting behavior could be controlled by the defendant, at the time of committing offense, the offending behavior was not under the control of the defendant. Okay, so that's important. Intent to harm need not be excluded. Okay, so intent to harm need not be excluded. No, if the perpetrator had previous expressed wishes to harm this person, the victim, and then they end up harming them but claim that it was an automatism, then that's less likely to hold. Okay, so the intent to harm need to be excluded. There shouldn't be a prior intent to harm. It has to be an accident for say an automatism to uphold. Okay, 30. The proportion of domestic violence that gets reported by women in the UK to the police. How much? What is the proportion of domestic violence that gets actually reported to the police in the UK? Only 1 in 5. Okay, for every 5 incidents of serious domestic violence, only 1 gets reported to the police. And this is data from this data is from 2012, and this is what the college has been using for the question. So remember this, 20%. Which of the following occurs in Ganser's syndrome? Confabulation, disorientation in time, place, person, pseudo-hallucinations, delusions, clear consciousness. Now, altered sensorium is common in Ganser's. In fact, the tetrad of Ganser's include alteration in sensorium, clouding of consciousness, okay, providing approximate answers, having somatic conversion symptoms, so bodily symptoms. There are usually also pseudo hallucinations. These are not the true hallucinations that you see in psychosis, but pseudo hallucinatory experiences are also common in Ganser syndrome. Okay, so the answer for the previous question is pseudo hallucinations. These are common in Ganser syndrome. Okay, now move on to the next question. What proportion of elderly offenders has a mental illness? Among the elderly offenders, mental illness is a little bit more common. 20% of elderly offenders have mental illness. Which of the following is an actuarial tool for violence risk assessment? Has Psychopathy Checklist, HCR 20, Violence Risk Appraisal Guide, Health of Nations Outcome, none of the above. Remember, you could use Hare's checklist as an actuarial tool, but it's not a good tool for predicting violence risk. It could predict psychopathy and associated behaviors in general. Of the things listed here, VRAG is a actuarial tool. So VRAG here, can you see VRAG? VRAG is an actuarial tool. Violence Risk Appraisal Guide. Static 99 is also an actuarial tool. SOROG is also an actuarial tool. So remember, Violence Risk Appraisal Guide is the right answer for the question here. VRAG. The prevalence of psychosis in present population is? The prevalence of psychosis in present population. So we saw the answer for this in Terry Brugger's paper. It's 50 per 1,000. Okay. Which of the following is associated with amnesia for offending? Shoplifting, automotive theft, high emotional arousal during the offense, elevated mood in the perpetrator, psychotic symptoms at the time of offense. The presence of amnesia generally goes with presence of high emotional arousal during the offense. Okay, high emotional arousal leads to or is associated with amnesia. Let's see some EMIs, legal terminologies. Each of the following descriptions, choose the best term applicable from this list here. Physical action of a crime is called actus rea. Okay. Let's see all the questions. Actus rea, not legally responsible for committing a serious offense before the age of criminal responsibility. So you cannot blame a child. You cannot, even if a child gets involved in a serious offense, you cannot call that as a criminal event because the age of responsibility, before the age of responsibility. Okay, there is a certain age only after which criminal responsibility can be pinned up. So what is that term used for describing this phenomena? This is doli incapax. Doli incapax. The intent to commit a crime. Oh, this is very popular. This is called mens rea. Mens rea is the intent to commit a crime. The guilty mind. Mens rea. So options are A, actus rea, C, doli incapax, and B, mens rea. The proportion of homicide perpetrators with the primary diagnosis of personality disorder that received prison sentence. Okay, so what is the proportion of homicide perpetrators with the primary diagnosis of personality disorder that receives a prison sentence? Okay, so option here is H, which is 90%. 90% receive, 90% of homicide perpetrators receive diagnosis of personality disorder. Okay. What percentage of homicide perpetrators with a primary diagnosis of personality disorder, so talking about this group, had no contact with mental health services in the year before? So this answer for this is G, which is 70%. So 70% of this group, people with personality disorder and commit homicide, have had no contact whatsoever with mental health services. Okay, so these are unknown personality disorder persons, and these are the ones who end up having committing homicides. What percentage of PD patients, PD is personality disorder, patients had no other psychiatric illness at the time of committing the homicide? So the answer for this is no other psychiatric illness is 45%. Okay, they only had personality disorder, pure personality disorder diagnosis, no other Axis 1 diagnosis. That's 45%. Okay, which is nearly half. What percentage of homicide perpetrators with a history of mental disorder has personality disorders as a primary diagnosis? So this is, you first take this group of people who have a history of mental disorder and then find out how many have personality disorder as the primary diagnosis. And for this, the answer is 25 to 30%. Okay, so well, I know this is really annoying, but this is how you have to remember. These are some of the statistics that you have to remember. Maybe you should write them down in a little notebook and revise them before you go for the exam, the day before the exam, because these are not easy to remember, but nevertheless they ask you these kind of EMIs in forensic psychiatry. Okay, so that concludes forensic psychiatry. Thank you.